Narcissism comes from the Greek word narcissus or Narcissus. An important thing that we should note here is that it actually comes from the Greek mythology, where there was this beautiful man by the name Narcissus or Narcissus. And according to the story, he fell in love with his own reflection because of how handsome or beautiful he was, and how he was so indulged in himself and admired himself to the point of rejecting other suitors and other admirers. And while looking at himself in the pool, he kept looking for so long and lost attention to the rest of the world. And eventually he wasted away and was turned into a flower. Some other narrations obviously that he fell into it while trying to kiss himself and was turned into a flower. But then I'm sure from this we all get the idea that he was somebody who was overly obsessed with himself and admired himself above all others. So narcissism refers to that excessive interest in or admiration for oneself. And in psychology, it refers also to self-centeredness, selfishness, feeling of entitlement, need for admiration, and lack of empathy. These points are important because for some time now, we've been hearing these terms thrown about. Oh, this person's narcissistic, that person narcissistic. But as to what it actually means and whether the person indeed is often not clear. So this is hopefully going to help us understand what this means. Then, as I said, we'll talk about narcissism and then narcissistic personality. So just to explain what a personality is, so that we'll put things in context as we go on. Persona actually refers to mask or character played by an actor. So the word came from stage plays, where the actors in the play would wear a mask to reflect one character or the other. But the word evolved into personality to mean a person's distinct characteristics in terms of their patterns of thoughts, emotion, and behavior. So these are a person's thoughts, their emotions, and their behavior in terms of how these define the person and make him distinct from others is what personality refers to. And one of the main distinctions between personality and any other aspect of human behavior or human disorders and so on is that personalities tend to be enduring. So they are present and occur throughout a person's life. So you realize that when you know a person's personality, even when a person is coming from a distance in the evening, you can tell that is this person by the way the person is walking, the way they are talking. If you know a person's personality, when a person writes a letter, you can read a letter and say, oh, this letter looks like it's Dr. Sedonia who wrote it, because the manner in which the words are constructed or the ideas are put down, Dr. Sedonia is the one who writes or talks like that. Okay, so that's what a personality is. Then let's look at some historical perspectives on this. So historically, personalities were thought to be due to a balance or the imbalance between various fluids in the body. So the ancient philosophers and physicians thought that there were four kinds of fluids in our body. And these fluids depending on which one was more predominant, would reflect a person's personality. So they describe the sanguine, which is those who have a lot of blood. Then you have the choleric, which is those who have more of yellow bile. Those who are melancholic, who have more of black bile. And those who are phlegmatic, who have more of phlegm. Okay. And even today, these concepts still exist, especially usually among some religious groups in terms of describing personality and so on, and even some psychological concepts, and usually refer to them as temperaments. As this person has a sanguine temperament, or has a choleric temperament, or melancholic temperament, or phlegmatic temperament. Okay, so when you hear of temperament, this is where it comes from. So personality disorders. A personality disorder is an enduring pattern of inner experience and behavior that deviates from cultural standards and are associated with substantial distress or impairment in personal or social functioning. This means that as we describe personality as the person's thoughts, behaviors, and so on that are peculiar to them. When these patterns deviate from cultural standards, or they cause the person distress, or they impair the person's functioning, so able to interact well with other people because of their personality, or the person is not able to work, then you see there's a personality disorder. And usually it may be manifested in 2 or more of the following areas. So it may be in terms of their thinking, and so for the cognition, so the way they think, their ability to concentrate, plan, and so on may be impaired and be evident in their personality disorder. Sometimes the problem is with their emotions. So they are very emotional, get upset easily, or do not show much emotion as they are expected to. And so when you're talking to them, it may be as if they are just blank, just looking at you as you talk. And their interpersonal functioning, this refers to their interaction with other people, related with other people at work, at school, at church, in the mosque, wherever. When there are problems with interacting with people because of an enduring pattern of behavior, then this person has a personality disorder. Or impulse control. So they are not able to control themselves. So they are more like impulsive. Once they feel like doing something, they just go ahead and do it without considering the consequences to other people or even to themselves. And you can have this kind of impairments. And when you have these occurring significantly enough to affect the person's function or the person's life, then we are talking about personality disorder, especially if these behaviors and so on have started early, usually they're diagnosed at age 18 and have been persistent in the person's life and seem to not change whatever that people say or do. Personality disorders are usually diagnosed after age 18. That's because we first provide personality. Then by the time they hit their teens, 13, 14, 15, they become quiet and reserved, they keep to themselves, they don't talk to anybody, and so on. And this may even change again by the time they come out of age 18. But usually, whatever pattern the person adopts by the time they turn age 18 and onwards remains. It seldom changes. It may change, usually when you have a personality change in such a person, it may be due to some injury to the brain or some other problems, maybe severe social distress or stressor, okay, like a severe loss, a very traumatic event, then their personalities may change. Otherwise, by and large, personalities remain steady after age 18. The exact cause of personality disorders is not clearly understood, but we believe that there are various factors that may contribute to this, and then the combinations of them. So you have factors like biological factors, where we talk about genes. So it's thought that, or it's been found that sometimes certain behavioral patterns are persistent or run in families, or that somebody's behavior may be similar to their mother's behavior or their father's behavior. And so there will be some genetic aspect to personality. And certain brain changes, either before birth or soon after birth or while growing up, may affect a person's personality and may result in a personality disorder. So there are various chemicals in the brain that are involved in behavior, thoughts, emotions that may be disrupted due to certain changes in the brain, and then these progress to affect a person's behavior and their personality in adulthood. Then the environmental factors. So the family, the person grew up in, or the patterns of behavior are picked from the family. So you sometimes childhood experiences may also affect personality or may result in personality disorders. So abuse during childhood, exposure to violence, exposure to traumatic events, abuse in terms of sexual abuse, physical abuse, head injuries during childhood, exposure to bad personalities or personality disorders, predispose people to also developing personality disorders. So it's important that we make sure that such people shouldn't go in conducive environment so that they do not develop personality disorders. So a little on the types of personality disorders. There's there are various personality disorders, as you can see from the list here. We all reflect different patterns of unusual behaviors or thought patterns or emotions. So the first three, the schizoid, the paranoid, type have some similarity. So some and here the main thing is that people tend to be less aware of other emotions. That the anxious tend to be anxious people, so they are referred to the cluster C in some criteria. Then those on the right, I separated them because that is the group under which the narcissistic personality fall. And these are what is called a cluster Bs. And usually there are a lot of issues with emotion and being eccentric about them, more focused on themselves and things like that. And so that's what a narcissistic personality for. Other personalities within this group are the histrionic, the antisocial, and the borderline personalities. So now let's zoom in into narcissistic personality disorder. So these days, there are many people who claim that their partners or their boss or some other person is narcissistic or has a narcissistic personality. But really, do these people have, or are these people actually having this narcissistic personality as people are throwing about? It's become a very common term these days. Okay. But narcissistic personality is usually characterized by being self-important, boastful, pretentious, and arrogant. These people tend to be preoccupied with fantasies of themselves being excessively powerful, successful, beautiful, or brilliant. So as you can see, it's all about them and how great and how awesome they are. So remember the story I told you about Narcissus. So they are very beautiful people. They believe they are the most beautiful people, most intelligent, most successful, powerful. And so they expect that others should admire and even worship them. And that they are so special, that they should have a special place wherever they go. And so because of that, they tend to exploit others for their own benefit of their own good, because as far as they are concerned, everybody else exists to serve them. And because of that, they lack empathy as well. So they're really good to see things from other people's perspective or people's experiences. It's all about them and how they feel. Also, because of that, they do not respect and when they because of their belief that they should be always on top or should be the best, when other people seem to be doing better than them or are getting the praise and the admiration that they expect that they should be getting, they may become envious. On the other hand, they tend to be that other people envy them because of how awesome they are. So you can imagine, it's not being a narcissistic person. So let's look at how, in terms of how often or how common is narcissistic personality. Now, the way people describe others as being narcissistic these days, you will think that probably half of the world is narcissistic. But the data finds that the general population is about 6.2%. If you pick 1,000 people, only 62 of them maybe have narcissistic personality traits. It seems to be more common in men than in women. So about 7.7% in males and 4.8% in females. These statistics are more from the West. Amongst Africans, it also ranges from 4.9 to 5.6%. So it looks like we are less narcissistic than the West or the general Western countries. But still, even here, the data shows that men tend to be more narcissistic than women. Now, the other risk with narcissistic personality is that it induces disorders. So we may end up having substance abuse disorders, so drinking, smoking, and also predisposed to bipolar disorder and depression. Depression particularly and suicide when the expectations of how people should admire and respect them are not met. And when they are faced or experience embarrassing situations, they find more distressing than most people would. And so maybe drawn to the point of attempting suicide because of how shameful or embarrassing that situation is for them. So how do we diagnose narcissistic personality disorder? So although you may identify or think that somebody you know or are related to or work with may have narcissistic traits, it is only a trained, qualified mental health expert who can make a diagnosis of narcissistic personality disorder. So, narcissistic personality disorder, that person has narcissistic personality disorder because of what you have seen or heard. Because even experts cannot just by looking or listening to somebody conclude that this person has a disorder. We'll have to go through a number of steps. It includes taking a history to find out when all this started, what the issues are, doing an examination of the person's mental state, even doing a physical examination, which involves looking at their physical health, and then doing various tests and investigations to find out if truly this person has narcissistic personality disorder. Okay, but it tends to be difficult to identify and manage people with personality disorders in general, but especially narcissistic personality, because they tend to think okay, if you believe that you are this awesome creation who is God's gift to the world and the earth, how we should get help because you may have a mental health disorder. So they most likely will not recognize or not admit to their problem. And even if others are able to convince them or talk them so those are the main challenge with making a diagnosis of a narcissistic personality disorder. There's a lot of difficulty in getting a person or individual to even seek help. But it's not just for narcissistic, it's an issue personality disorders in general. But how is it going to be treated? The other aspect of that is there are challenges to treatment as well. It's quite difficult to treat. And the reason is that personality disorders, by definition, because they are issues with the person's personality, it tends to be more enduring, because they persist. And so you are not going to change a person's personality overnight. But it doesn't mean that there's no help. Okay, it has to be managed. And usually the mainstay or the main approach is psychotherapy. The target being helping the person leverage on their strengths, on the strengths of their personality, and then also guiding them to be able to deal with and develop ways of coping with their weaknesses and overcoming their weaknesses. So we have various therapy approaches that we use. We do individual therapy, so the one-on-one with the person, which will involve things like social skills training, teaching a person how to interact with other people, so that they do not offend them or do not feel, or they themselves do not end up feeling offended. Sometimes it may be important to include family members in the therapy, okay, so that they can understand what's happening with the person, so they can be of help to the person, but also not to encourage the person's, for lack of a better word, their bad behaviors. Sometimes support groups also help, so that you meet other people with similar challenges. They talk and they share how they are coping, how they are improving or recovering, and their challenges that they are facing, so that they can help each other. So support groups may also help with personality disorders, including narcissistic personality. Then there's a small role for medications here. The role of medications here is not to treat the personality or personality disorder. But as I said earlier, some people may have depression, bipolar, suicidal ideation, anxiety disorder, or some other psychiatric disorders associated with the personality disorder. The approach is that once you are managing the personality disorder, you also have to manage the associated psychiatric conditions so that they get relief. Otherwise, you may think you are progressing or doing well with the personality, but because the person is still experiencing those other aspects, they still are unwell. So it's very important that when such a patient is being assessed and managed, these aspects are also taken into consideration. Now, if you find yourself in a relationship with somebody with narcissistic traits, or you think is having narcissistic traits, what do you do? So first of all, let's not put all or bundle all inappropriate behaviors into narcissism. Okay, there are people who may not have narcissistic disorder but still have bad or poor behaviors. Okay, not every bad behavior or poorly behaved person or every person who does something you're not pleased about has a mental health disorder. So you have to be careful not to label people just because you do not agree with their behavior or their stance on certain issues. That's the thing. Sometimes we do these words about when somebody disagrees with us or our views on something. So this person might be narcissistic. Actually, we have a very strong opinion, a very strong view. However, if indeed you are with a person who has traits that you think may be narcissistic, or you're experiencing any challenges in your relationship with the person, always, I repeat, always, and again, always prioritize your own safety and your mental health. Okay. Seek help from mental health experts if you need therapy or any kind of support for yourself. It can be very difficult dealing with people like this. So please put your mental health and safety first. If there are threats at your life or your safety, also inform the police. Some people, particularly those with narcissistic traits, may have a hard time accepting rejection because they believe that they should be admired and loved by all, and so may actually take steps to harm you one way or the other. If you feel threatened, please inform the police or any appropriate agencies to get the help that you need. If that relationship is going to pose a risk to your physical and mental health, please leave. Do not stay in any relationship, whether it's a narcissistic person or not a narcissistic person, whatever relationship you are in. Do not stay in a relationship in hopes that you are going to change anybody. You are not jollof, you are not chocolate, you are not Superman or Superwoman. You will not change the person. The person has had this personality for all their lives. They've been doing this all their lives. Apart from the movies and telenovelas that we watch, in real life, it doesn't happen like that. When somebody loves you so much that they change overnight and become a new person because of you. So please, if you are going to, it's going to result in injury to yourself or any risk of harm to your mental health, do not stay and hope that you will change the person. Now, it's always important to encourage the person to get help. Of course, if it is you also, then I encourage you to get help. If while listening to this, you find that some of the things that have been described as being narcissistic described to you, get help. You may advise the person directly if you have that relationship with the person, and if the person listens. It may be necessary to get assistance from the person's parents, close relatives, or some persons or people that the person respects enough to listen to. Usually, a 10% that there are very few people like that in their lives. Okay, but if you're able to identify somebody like that and reach out to that person, you may be able to get the person to get help. So, rounding up, we just go over again. As I said, narcissism is, as a trait or as a behavior, is characterized by persons who, by being overly indulged in oneself, excessive admiration for themselves, and so becoming arrogant, proud, and so may even become envious of other people because they feel they should be the ones succeeded or progressing. They may lack empathy because they cannot see or understand things from other people's perspectives. And they may also feel that other people envy them. They may have other medical, psychiatric conditions related to that, such as depression, such as bipolar disorder, or any substance abuse. And they are at a high risk of suicide, especially when they are exposed to embarrassing situations that they feel should not be happening to great people like them. Remember that even if you find such traits in a person, it is not your place to put a diagnosis on the person. If you can encourage or get a person to get help, the appropriate mental health workers would assess, make a diagnosis, and start treatment. As I said, the treatment typically entails psychotherapy. And although it is challenging, a long-term approach which focuses on enhancing a person's strengths and helping them deal with their weaknesses is effective. Sometimes it's important to involve other people who are closely related to them, like family members, like friends. It may also be helpful to sometimes, if you can find where there are groups, support groups with people with similar challenges, so they can discuss their progress, their strengths and their weaknesses, and help each other. That might also be helpful. And most importantly, if you find yourself in a relationship with somebody who has such traits and you are concerned about your relationship, always prioritize your own mental health and safety. If you have to leave for your own health and safety, please do. Do not stay in a relationship with the hope that you're going to change anybody, because you will not. And as much as possible, let's encourage such people to get help. And not only people with narcissistic personality or personality disorders, but anybody who's experiencing any mental health challenge or mental related disorder or problem, let them get help because there's help available. So thank you very much. I'll pause here for questions so that we can address them.
Thank you very much, Dr. Richard Day Asamoah, for such a thorough presentation on narcissism and narcissistic personality disorder, and most importantly, your advice on people who may find themselves in a relationship with a person who may likely have such a condition. Thank you very much. That is great coming from an expert. So he's done everything. He's gone through it, or how people who may be having narcissism present, what you should do should you find yourself in such a situation. If it is you, what you should do, and the management plan for it. Everything has been shared. If you have any question, we have a few minutes more before he can jump on to his next things that he has to do. Please put your questions in the comment section, in the chat box, and he'll be glad to answer. But my first question is, in the cluster B, how easily are you able to differentiate between, let's say, histrionic and narcissistic personality disorder? Because cluster B, like you said, it's more of emotional issues, more emotional overload. A lot of them have emotional issues. How easily is he able to differentiate between all the four in the cluster B?
But the important thing to know is that as Again, I might have to put on my video. Looks like I have some internet issues. So the important thing to note is that for the for the distinction or the differentiation between two or more personalities, for the layperson, it's not your role to do that distinction, and you likely will not be able to. Okay, what if you once you are able to recognize as a problem, that's good enough. Get the person solved. But for us as professionals, there are subtle differences between them that we have to we identify. Okay, so the histrionic, for instance, they are more dramatic. So they seek attention by over dramatizing. So if it's pain, they are in more pain than everybody on earth. If it is anything, any emotion, if it's tears, if they are sadder than everybody on earth. If they're happy, they're happier than anybody on earth. Okay, so it's a dramatic nature of it. On the other hand, they are not particularly, for lack of a better word, grandiose or feel like they are better than everybody else. It's just that they feel that they should have the attention. But the narcissistic person is the one who is better than everybody else. He's the most important person on earth. He's the biggest man in the room. He's the kind of person who asks you, do you know who I am? Okay. The histrionic person would rather be asking you to do everything for them or would expect you to see how sad or how tearful they are or how much they are in pain as compared to everybody else. Okay. So those are the main differences that one may find between those two. And we will find that in terms of epidemiology, whilst I said that the narcissistic tends to be more common in men than women, the histrionics tend to be more women than men. Yeah.
Okay, once you are there, just help us touch on borderline as well for us. Once you are there.
Okay. So the borderline, the classic description of them is that their emotions are like having third-degree burns. So they are very sensitive. Their emotions are very sensitive. So they form very superficial yet intense relationships. Okay, they have this fear of abandonment. So they once they start feeling or being afraid, worried that you might leave them, they become overly clingy, even threaten suicide, threaten to harm themselves, anything to keep a relationship going. So one of the telltale signs of borderline is that the person cannot remain single for long. They're almost always in one relationship or the other. But then they are so emotional and so overbearing in the relationship that their partners also tend to want out. And the ones they start wanting out, then they start threatening to harm themselves or even harm the other person if they because now they are now afraid that they're going to be left alone. So they have this also have a sense of emptiness. They have a general sense of emptiness and avoid that they constantly are craving to be filled. This disorder is also quite tend to closely related to bipolar disorder, and sometimes people may have both occurring within one person. And since I'm here, I might as well just go on and talk about the antisocial personality as well, or the dissocial personality. So these are for the antisocial, most of the time before you start thinking or learning in psychiatry, you will think antisocial in terms of the way we think of it in everyday communication, where it's somebody who seems to avoid social environments or social settings, but that's not the case. Antisocial personality is somebody who, so it's more or less like against society. So they have no respect for the rights of other people. They have no respect or value for laws. They flout laws left, right. They injure people when they have to. They don't mind running you off over with their car if you are taking too long to cross the road. Okay. They don't mind attacking you and taking your phone if they feel that they need a phone. So they usually tend to be overrepresented or occur more in criminals, people with who engage in criminal activities and things like that. And sometimes the challenge is that, yeah, so people who flout or blatantly disrespect other people's rights and may even cause injury or harm to them. In fact, quite a number of people who have what the personality in their childhood may have met the criteria for diagnosing something called a conduct disorder, where in childhood they also have little value or respect for rights of others, just like that. And you find that even in childhood, they cause harm or injury to other children, to animals, domestic animals, and so on. So if you have a child who comes home and starts breaking the neck of the chickens in the house for no reason, or is throwing stones at cats for no reason, you should be concerned that it may be the beginning of a personality.
Yes, there are children who can just yank off the head of the chicken, and you think you should be suspicious of something. They are killing all the animals in the house, all the pets, they are hurting people, all conduct disorder right there. It's very important. We are glad that Dr. Richie Deasamo has differentiated between the 4 cluster B personality disorders. The antisocial, like he said, they have no respect for your rights. They lack empathy. The borderline, they have fear of abandonment. They form superficial yet elaborate relationship with people, and they almost always feel empty. For the histrionic, they are overly dramatic. Everything they have the topmost. If it is pain, they are the ones who are in the most feeling the most pain. If it is anything, they are the ones feeling the highest. And then the narcissistic, they are the ones who always feel they are better than everybody else. Everybody else envies them. They are more beautiful. They are more intelligent. They claim they are more intelligent. They self-centered, selfish, and all that. So the reason why I made him do that was because sometimes the traits may, some may be common among all of them because they're all on the same side. So you cannot tell, just like he said. So if you find somebody having certain traits, and you think it's a problematic issue, just get the person to seek help. Or if you are in danger, do exactly what Dr. Deasama was advising us. Now, there's a question. Are these people born or made? That's the first question. The second question is, what's the difference between sociopath and psychopath?
Wow. Okay. So, are these people born or made? Yes. So that raises what you call the nature versus nurture debate. So that were they born that way, or that is from what somebody did or somebody said or something like that. Now, somewhere during my discussion, I mentioned that the exact cause is not clearly understood, but it is thought to be as a result of a combination of factors. Now, those factors include factors that are more or less existent or occurring in the person even at the time of birth. Or yes, so like the genetic factors and so on. Then there are those that there are also certain factors that are after birth. So there are childhood experiences, injuries that they may experience, and so on. Now, the short answer to that question is that it's both. Okay, so people may be born with the predisposition to being having a personality disorder, but the exposure in the environment also contributes. So it's both sides. They are born sort of that way, but then the experiences also increase the chance of them becoming that way or make them that way. All right, so it's a balance between the two. For somebody, it may be more of the being born that way. For another person, more of the being exposed to factors that made them that way. But in most cases, it's a combination of both. Yeah. And then, yeah, so the difference between the sociopath and the psychopath actually depends on who you ask. Okay. Because I've I've actually asked this question myself a number of times, and I've done readings on it and so on. But I find that it tends to depend. Some people put them together as being the same, but some distinguish between them and say that, and the difference is that some believe that the sociopaths are less calculating or less, they have less intent of causing the harm or disrespecting other people's views and things like that, as compared to the psychopath. Okay, so the sociopaths tend to have regrets afterwards, or they may have some regrets afterwards. But the psychopath, on the other hand, everything they did is deliberate and well planned and have no regrets or remorse. So they are more closer to the antisocial personality than the sociopath. Okay, so the psychopath will sit down, plan and think and say that, okay, I am stepping out to harm this person. I'm going to do this to the person. I'm going to do this person. I'm going to do this person. Okay. On the other hand, the sociopath may get upset with you, or in a situation where he wants his way, may do whatever it takes to get his way, even if it means harming or hurting you, but may have some level of remorse afterwards. So that's the distinction I have found. You're looking at the differences between them. Yeah.
Yeah, what I also found out is some psychologists say the sociopath is more of a higher environmental influence.
Yeah.
While the psychopath is more of a genetic predisposition that is unearthed by the environmental exposure. So exactly. That's why they said the sociopath have some level of empathy after they commit the acts. Yeah. But the psychopath is like, for them, nothing.
Exactly. They are just doing what they are doing. Yeah, and they know what they are doing.
They plan to hurt you, and they come and hurt you, and they go. You are hurting, they are laughing, they are smiling. Exactly. Those are the ones, So sociopath is, in Ghana, I might say, somebody who is predisposed, but live in an area like Ashama, Nima, with all due respect, though, I know that. Yeah, places like that that are used to, that kind of thing. So that is what some psychologists also say. So thank you very much, Dr. Dave. So again, in that same vein, somebody was asking, can we actually raise narcissistic children? Also, that's the same approach. Yes, the environment, how you bring them up, if you make them feel all that. So yes, I think that question has been answered. We have 5 minutes more to go. If anybody has any more questions, the reason why we are taking our time to delve into this issue is that people are putting too much labels on just everybody. You're in a relationship, there are issues, and they just label you. My husband, my boyfriend, my girlfriend is narcissistic. And if you ask them, what are they doing? And then they give out symptoms, and you like, they may just be traits. So there's a difference between a trait and a disorder. Traits, most of us have a lot of traits. That may not be a disorder. For it to be a disorder, doctor clearly stated it. It has to cause distress. It has to be pervasive in terms of your cognition, your affect, your everything, your interpersonal relationship. It has to be pervasive. But traits may not be causing distress, may not be as pervasive. So we should, guard against just throwing the words across. If you are labeled a narcissistic personality disorder person, somebody living with that condition, you need help.
Yeah.
You will need help. All right. Just like, go ahead. Please go on.
Even some psychologists and some people believe that almost everybody has some level of narcissism in them. Okay, because you still want to be the best, you want to be on top. Okay, but it's when it becomes so excessive that it's impairing or affecting your interactions and relationship with other people. That's when it becomes a problem. But if you look into yourself, you even find that you still have some level, unless you have, and it's important, even that aspect of that level of narcissism is required or important in terms of your own personal growth and development. Okay, so that is there. But when it becomes so excessive or to the point that it's affecting functioning and so on, then we can now see the person as a disorder. So just the fact that you are seeing somebody who is finds that things are important or they are good I mean, if you think about it, the reason why we have a lot of issues. Nobody thinks their school is the best school. Nobody thinks their tribe is the best tribe. Everybody thinks their village is the best village. Their country is the best country. Their race is the best race. Because of those levels of narcissism that we all have. Okay. Yeah.
So just like Doctor says, we are all selfish naturally, all of us. If there is only one thing and you are to, if there is oxygen points, you are advised to use first before you help another person. Are you not being selfish in that respect? Yes. So we all have some level of traits of these personalities in terms of personality, but it doesn't become a disorder until it causes so much distress, until it infringes upon other people's spaces. You see, so we need to get, that is why we are speaking with an expert. And this is someone who is both a specialist psychiatrist and a clinical psychologist. So you should know that he knows exactly what he's talking about. I actually like how you started it with the Greek mythology about the Narcissus guy and how he fell in love with his own image in the river. And he just, a lot of all those stories around it. So thank you very much. We still have 2 minutes. If anybody has any question, I hope those on the call, those joining us live on YouTube and all that, and those who are going to watch when the recording is posted, I hope all of us have been well educated on these personality disorders. We took time to also explore the other commonly related ones, such as histrionic, who are almost always overly dramatic. We also talked about borderline, who are almost, some are manipulative. They always want to be in a relationship. They always has fear of abandonment. They're always empty. So they move from one relationship, tomorrow they're in another one, tomorrow they're in another one. They never want to be empty. I actually know somebody right now who is threatening the partner. Should you leave me, I'll kill myself and kill you. So that's, these things are real. Okay, and then we talk about the narcissistic and then the antisocial personality disorder person as well. We need to know there are traits and there are disorders. If you're a little worried for the person or for yourself, the best thing we can all do for ourselves is to know ourselves, our self-concept. All right. So if you think you have traits, seek help. That is a reason for all these things. Seek help from a mental health professional, from any of the facilities all around Ghana, across Psychiatric Hospital, Pantai, Kolebu, a lot of private hospitals that have access to psychiatrists. Our numbers are increasing now. If you still don't know where to go, you can reach out to me. My number is on the YouTube channel, and we'll gladly help you. And so, are there any questions? I think somebody made a comment in the chat. Okay, somebody just saying thank you. It was a wonderful presentation. Thanks, Dr. Day and someone. Any questions? Any questions? Any questions? I have been washed, you understand? And I hope you have also been washed. I have learned a lot, and I hope you have also done the same thing. If you have any question, we have 1 more minute just to go. 1 more minute. All right, thank you very much. There is, however, help. It's not all doom and gloomy. No, we just have to know this is the issue, and then we know how to help you. Mind you, there is genetics, there is genes involved. It's not always entirely that you got brought up in a bad place or whatever. Okay, so there is help available to help you, skills training and all those psychotherapy or support groups, most of which we lack in our parts of the world. Support groups, you get to hear from people who have also been there, and how they are dealing with their situation and how they're able to reintegrate into society and live productive life. So we do this just to get people to have the right knowledge. So next time somebody throws the word around, do the person a favor. Share the link of this recording on the YouTube channel to the person to learn more about what it actually means to have a personality disorder. And that the person may just be having normal traits or just normal personality traits or narcissistic traits, not necessarily a personality disorder. All right. Thank you very much. Thank you very much. All of you, please join me. Help me thank Dr. Richard there someone for making time. If I tell you how busy this man is, you won't believe me, but he's made time to come and share knowledge with us. We appreciate you so much. I've learned a lot, and a lot of people are also indicating in the chat box that they've also learned a lot. And once again, for us, when you do us good, we will always call you back at another time. So we are putting our application already before you that soon we are likely to come to your doors and ask you to come and teach us more on some other topics. Thank you very much, Dr. Richard, for such a wonderful presentation. It was clear, It was clear and straightforward. We appreciate it. Thank you very much. And to every one of you who's on the call, who joined us, and to those of you who are going to watch the recording, we appreciate you for making time. Until next time, it's been a pleasing pleasure serving you all.